The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon and welcome to Reproaction's Act and Learn webinar for the month of September 2020. Today's topic is Free Brittany, respecting the autonomy and decision-making of people with disabilities. Hosting this webinar are the co-founders and co-directors of Reproaction. The first voice you're hearing is Erin Matson. I am based in Arlington, Virginia. I use she, her pronouns, and I am Erin to the max on Twitter.
And I am Pamela Merritt. I use she, her pronouns. I'm based in St. Louis, Missouri, and you can find me on Twitter at SharkFoo.
Great, so buzz through the agenda and feel free to live tweet at any point if you'd like using hashtag Reproaction. We will introduce Reproaction. We'll talk about why a conversation about disability and bodily autonomy is so important. We'll do a brief overview of disability rights in the United States, and then we'll have a great conversation with an expert, Dr. Robyn Powell. From there, we'll move to next steps and Q&A. So just one additional piece, if you have questions, you can put them into the questions box at any time. You don't have to wait for Q&A at the end. And when we get to that point of Q&A, Pamela will moderate the discussion, so she'll get to as many of those as she can. So briefly, Reproaction, who is this organization? We lead bold, direct action to increase access to abortion and advance reproductive justice. We're deeply proud of our left flank analysis and our willingness to hold folks on all sides of the issues we work on accountable, whether they're traditionally considered allies or opposition. In other words, we're fearless. We also have a deep commitment to nonviolent direct action as one of the tools in our toolbox. And with that, I'm extremely proud to introduce our campaign coordinator based in Arlington, Virginia. Kara Mailman uses they, them pronouns, and they've been with us over 2 years now. And with that, I'll hand it over to Kara.
Hello, everyone. Super excited to join you today for this webinar. If you could please click through to the next slide for me. Thank you. So I first want to start just by briefly talking about why a conversation about disability and autonomy is so important. First, it's just something that we do need to keep raising awareness of and starting a conversation about. As we've seen so publicly with Britney Spears, this is something I'll get to more in a minute. People with disabilities are continuing to have their ability to lead self-directed lives called into question. And even in progressive spaces, people with disabilities continue to be discriminated against. This especially applies to physical organizing spaces. People with disabilities are very literally kept from the table by physical barriers to entry. This can be things such as ADA non-compliant venues, so venues that have stairs, don't have ramps, don't have elevators, and things such as a lack of American Sign Language interpretation for these kinds of events. And these conversations about disability end up frequently happening without the presence of people with disabilities, even in progressive spaces, because of these physical barriers. The other reasons this conversation is important is because we need to continue as a reproductive justice organization to promote principles of reproductive justice, such as equity and bodily autonomy. Next slide, please. So, I am going to very briefly touch on the ways society has taken autonomy from people with disabilities. And at the top, I'd like to flag 3 things. 1, this is not in any way comprehensive. Our society has a long and terrible history of taking autonomy from people with disabilities, and there is no way I can touch on all of that during this time. 2, just because most of the cases that I talk about come from the US, doesn't mean that other countries are off the hook. So if you're tuning in from a country other than America, you should also check in on so much more knowledge she can share with us on these topics. So I want to start by talking about the case of Britney Spears. For anyone who was not a 90s baby, let me just briefly say that Britney Spears was a teen pop icon in the late 90s, early 2000s, and made quite a name for herself doing so. Britney Spears has been since, I believe, 2008, been under a conservatorship, which means that she effectively does not have control of her own life because she is a person with disabilities. Her father has been given control of her conservatorship, a thing that Britney's lawyer has specifically said she does not want. She has specifically spoken out about or against her father's control of her conservatorship. Judges have not listened to this and have recently extended her conservatorship through 2021. And interestingly, the American Civil Liberties Union has said that many conservatorships, including Britney's, are unnecessary or poorly thought through. And many of the people who have been placed under these conservatorships do not actually need the type of management and oversight that a conservatorship that our society has taken autonomy from people with disabilities is through our history of forced sterilization, specifically of people who can become pregnant. This has been and continues to be done using the rhetoric of population control, which, as many know, is largely based in eugenic beliefs. This kind of forced sterilization can be done through guardianships. So people who have been given legal control over people with disabilities can call for them to be forcibly sterilized without their consent. This may also be done through coercion, whether by doctors or by family members. This is done in part because our society has chosen to not provide support for people with disabilities, especially for people who want to parent. And unfortunately, this is not something that has gone away. In 2018, Washington State introduced a law that the ACLU believed would make it easier for guardians of disabled people to have them forcibly sterilized. So this kind of sterilization is ongoing. We've also taken autonomy from people with disability through custody laws. Specifically, more than 2/3 of state-level child welfare laws consider parents' disability a reason to terminate parental rights. And this is, again, because our society is biased against people with disabilities and has not created a support structure for parents with disabilities. This is especially true for Black and Indigenous people with disabilities who are overrepresented in the child welfare system. People with disabilities frequently have their sexuality completely dismissed. Sex ed courses are not made with disabled people in mind. Our society frequently infantilizes people with disabilities, and because of this, some people with disabilities are kept from attending sex ed courses completely. And this also means that sex ed courses don't necessarily address differing mobility issues, and so the pleasure of people with disabilities is completely overlooked. And finally, I've said this a couple of times, but our society has completely failed to provide resources for people with disabilities, especially people with disabilities who want to parent. Schools, daycares, and extracurricular activities frequently aren't accessible for parents with disabilities, whether this means there are stairs that don't have wheelchair ramps near them, whether this means there are no restrooms available on soccer fields. And the Americans with Disabilities Act has not done nearly enough to help, and there are still regular violations of this act that have not been dealt with accordingly. And that is all for me.
Thank you so much, Kara. So now I'm incredibly pleased and proud to introduce Robyn Powell, a visiting assistant professor at Stetson University College of Law and a proud disabled woman. Dr. Powell's scholarship and activism are based in reproductive justice, primarily focusing on the right of people with disabilities to have children and to safely raise their children. Dr. Powell, thank you so much for joining us this afternoon.
Thank you so much for having me today. Before I begin, I just want to say that I too grew up in the 90s, so I too am a huge Britney fan. So I was excited to talk on this webinar for not only because it was about disability and autonomy, but because it references one of my favorite singers growing up. So with that, I just want to say that when we're thinking about disability today and throughout our work, we need to really think about it from a very cross-disability perspective and really focus on how we look at disability. So when you think about disability, often you will think about people who have visible disabilities. So people like myself who use a wheelchair, or maybe someone who's blind or who's deaf. But when we talk about disability, we really need to recognize that disability is a very encompassing term. So it also needs to recognize people with intellectual disabilities and people with psychiatric or mental health disabilities. And also we need to remember that people with disabilities often have multiple disabilities, so co-occurring disabilities. So I encourage folks to take a cross-disability perspective in their work and really recognize that disability is very expansive and inclusive term. I also think it's important to recognize that disability is something that transcends lots of different identities. And so people with disabilities are often members of multiple marginalized communities. So you could be a disabled person who's also a person of color. We also have Indigenous people with disabilities. We have LGBTQ people with disabilities. So when we're thinking about disability, we have to make sure that we're taking an intersectional lens.
Thank you so much for that. And I really appreciate the reminder that we need to think about this intersectionally, and also that disabilities are not visible, that they cross and co-occur. Thank you so much for joining us today. And also, as a fellow Britney Spears fan, I'm smiling, and I want to express on a personal level my deep appreciation to Kara Mailman on our team for explaining who Britney Spears is to anyone who might not know. So my first question for you is, in your professional as well as personal experience, what are some of the ways society has taken away the autonomy of people with disabilities?
Sure, so that is a very loaded question and one that I could talk about for hours, so I'm just going to give a few examples. So some of the things that we heard about already were sterilization. So the United States has a really horrifying history of coercively sterilizing people with disabilities, particularly people with intellectual or psychiatric disabilities. And this actually gained the blessing of the United States Supreme Court in the Buck v. Bell case in 1927. And for folks who don't know that case, that this was a case where there was a woman who was deemed feeble-minded, they called her, and she had been institutionalized in Virginia. And the state had a law on its books that said that people could be forcibly sterilized. And so they made it her leaving the institution based on the contingency that she become sterilized. So right after she had given birth, she had been raped, and so she had been pregnant, and so she was forced to give birth, and then they sought to sterilize her against her wishes. This went up all the way to the Supreme Court, and the Supreme Court said it was constitutional. It was fine to forcibly sterilize Carrie Buck. That was in 1927. Ultimately, roughly 30 states ended up having forced sterilization laws on the books, and over 70,000 people were sterilized in the United States by the 1970s. I will say that I think that number is vastly underestimated, because I cannot imagine they were actually keeping good data on who they were sterilizing. So I often like to preface that. I also want to say that I said that she was deemed feeble-minded, Carrie Buck, and actually later they determined that she was not actually disabled in any way. She was presumed to have a disability, and in fact, really all she was poor, and she had low education. So she really just shows how the perceptions of disability can even perpetuate a lack of autonomy and just equity. So that's one way. And so I talked about that and how that was part of this eugenics movement. Unfortunately, though, we're still seeing lots of instances where people with disabilities are losing their autonomy. So sterilization is a thing that continues to exist today in the United States and across the country, or globe rather. And while, you know, ideas about eugenics have waned over time, it's still something that a lot of people with disabilities, particularly intellectual or psychiatric disabilities, face. We saw more recently in 2012 a case in my home state of Massachusetts involving a woman, Mary Moe, who had a psychiatric disability and was pregnant. And the courts authorized her parents to have guardianship on her so that they could forcibly terminate her pregnancy. And then the court went so far as to say, and throw in a sterilization while you're at it, essentially. So Mary Moe did not want to terminate her pregnancy, and she certainly did not want to be sterilized. It was against her religious views. Fortunately, on appeal, that was overturned, but the fact that the court just threw in this sterilization, it wasn't even something that anyone was asking for. They said that it was something that should be done to avoid this from happening again, that is her becoming pregnant. Just shows that there's still this lack of respect for people with disabilities in their bodies and their autonomy. So I think that that case, which was in 2012, so not even 10 years ago, in Massachusetts, which is considered progressive, shows that these things still happen. And there's also issues around coerced abortions. So people with disabilities, when you think about abortion, this is really complicated because in one respect, we want to make sure that people with disabilities have the opportunity to choose to terminate a pregnancy if they so choose. On the other respect, we want to make sure that they're not being coerced into doing so. And that is something that people with disabilities continue to experience is, you know, we see that you're pregnant, it would really be best if you terminated this pregnancy. And I will tell you from a personal standpoint as a disabled woman, when we talk about sterilization, I've been offered a hysterectomy multiple times for no medical reason, just an assumption from doctors that I would want to not have children, which could not be further from the truth. So we really need to understand that this is a significant issue that's facing lots of people. And I often think if it's facing someone like myself, who's, you know, I recognize I'm very privileged and I have strong education, I'm an attorney and I have a PhD. If I'm having these experiences, what is happening to the average disabled person? So I just want us to understand that this is a really big ongoing issue. We also, as we heard, Britney Spears brings out the issues around guardianship and or conservatorships, depending on which state you're in. And people who have guardians or conservators are really prevented from making such important decisions in their lives. Things like making their own financial decisions, which is something we've heard a lot about with Britney Spears. It's also things like choosing where to live or who you want to marry, who you want to spend time with. Making your own healthcare decisions is another thing that is taken away from people who have guardians or conservators. And something that we need to recognize, particularly in 2020, is often if you have a guardian or conservator, you're not able to vote. Again, remember that you are not able to vote often. There are over 30 states where you can be restricted from voting if you have a guardian or conservator. So that is a big group of people that will not be able to participate in the 2020 election next month. So again, that's another way in which autonomy is just being taken away from people with disabilities. Also, if you are living in any sort of group home or congregate or institutional setting, you have almost no autonomy. Disabled people aren't even allowed to decide what they want to eat, when they want to eat, when they want to shower, when they want to go to bed, when they want to get up. So just basic life decisions are taken away from people with disabilities who are living in facilities or group homes. And then there's really these, I think, less explicit examples where autonomy might not be explicitly taken away from someone, but the results are leaving people having no autonomy. So things like lack of access and justice often really inherently affect autonomy. Things like if you can't go to the health, get reproductive health care because it's not accessible, you are in some ways losing your autonomy. You just don't have those choices. So we really just need to take a really expansive view on what autonomy looks like and how it's taken away from people with disabilities.
That is so powerful and so troubling to consider the ways in which people with disability are being trampled upon in our society, revoking all aspects from the right to vote to the ability to have children, which is an important step. So Reproaction is a reproductive justice group, and as such, and as I said in the opener, we hold folks to account no matter where they come from. And there is a deep need for reckoning within the reproductive rights movement writ large about specific reproductive oppression experienced by people with disabilities. And so I wanted to ask to you, what complicity has the reproductive rights movement had in the denial of autonomy for people with disabilities, particularly on the question of reproductive autonomy? And then as a follow on to that, are there specific changes that you think should happen now? And especially with so many people on the line, most of our supporters who listen to these webinars are activists. So this is really a place where we can seed some major changes within our movements.
Thank you for asking that, and thank you for recognizing that there are tensions that have occurred between the reproductive rights movement and the rights of people with disabilities. Unfortunately, the reproductive rights movement has had a troubled history when it comes to disabled people. To give you a very recent experience, during the Zika virus a few years ago, I think that people with disabilities were really troubled by the way in which the reproductive rights movement was publicizing information on the Zika virus. It was very ableist and felt very eugenic when they were talking about the virus. And so I think that that was just a really current example in ways in which the reproductive rights movement has in ways really been ableist, I would say, and not really recognizing people with disabilities as something that should be involved in the reproductive rights movement. I think that also we have to remember that the focus on choice really has entirely overlooked who actually gets to make these choices. As I've talked about a lot today already, people with disabilities, they're not getting choice. And so the reproductive rights movement has focused so much on choice, not recognizing all of these barriers that people with disabilities face. And really, they don't have choice. And so I think for that reason, I really appreciate the reproductive justice movement and looking at it through that framework. We know that the reproductive justice framework was developed by women of color, and they did so based on many of the things I've just said, how they recognize that there are socially marginalized communities who aren't even offered the opportunity for choice. And so we can't focus entirely on choice, not looking at the systemic and structural barriers that impact choice. So when we're talking about reproductive justice, we know that there are three overarching principles. So the first is the right to have a child. The second is the right to not have a child. And the third is to have the right to safely raise your child. And so I really think that we should embrace this reproductive justice framework in our work and really include people with disabilities at every level. So when I say that, I think we need to really address the systems that perpetuate ableism and impact access to reproductive health services and information. And we also really need to take a broader systems change approach that addresses the way ableism is deeply ingrained within our society. To give you a few examples of what I mean, if you don't have transportation to get to a reproductive health care provider, you can't receive adequate services. So we need to look at barriers around poverty and accessible transportation. If you're deaf or hard of hearing and you're not offered either a sign language interpreter or captioning, again, you are similarly impeded from accessing services. So we're already limiting whether someone has these decision-making opportunities. More broadly, if disabled people are denied opportunities to parent, as you mentioned earlier, because of discrimination and assumptions that they are unfit, they don't actually have choice. So it goes back to this whole what is choice and who is able to make these choices, and how do the systems really impede one's ability to make these choices. So that gets to what changes should happen now. And I think that we have seen with the loss of RBG and the nomination of Judge Amy Coney Barrett, who is very anti-choice, the real need to make sure that reproductive justice and rights are, center stage. And within that, that needs to include disability. Eugenics and disability are really unfortunate friends. They've been companions for far too long, eugenics and ableism really. And so we need to recognize that and then base our work on that recognition that disability is deeply, or ableism rather, is deeply ingrained in eugenics. So that includes really things like making sure that people with disabilities are at the table. A good colleague of mine often says that if you're not at the table, you're on the menu. And it's so true. People with disabilities are just not involved in these conversations. you know, we see this time and time again. I'm thinking about during the Women's March, people with disabilities had to fight to be put onto their agenda and the policies that they were proposing. They were overlooked, and women with disabilities are existing in large numbers, and people with disabilities, we are a significant part of the population. So just making sure that people with disabilities are part of all of your work, making sure that they're not just offered tokenized positions, but actually leadership roles is really important. Making sure that all of your work recognizes and includes disability, and how ableism is deeply ingrained in all of the work you do is so important. And in particular, I want to say that we need to make sure that we are including LGBTQ people with disabilities, and also people of color and Indigenous people with disabilities. So we need to just make sure that not only are we including people with disabilities in this work, that we're including a diverse group of people with disabilities in this work. And again, people with disabilities are really interested in this work. We have a lot at stake. And so I think that, you know, we're going to see a lot of movement on these issues, or particularly with the loss of RBG. And so this is a great time, if you're not already including disability in your work, to finally catch up and include us. And we are eager to be involved.
Thank you so much for all of that powerful insight for our listeners. We really appreciate it. So kind of stepping back, and I think you've already touched on a lot of these themes, but it's important to dive into it at a more general level. What changes can we make in a whole as society in order to better support pregnant and parenting people with disabilities?
So that's exactly what my work is focused primarily on, so I'm thrilled that you're asking me that. So we need to make sure that people with disabilities have the opportunity to decide if they have children. That is such a important right that everyone has, and yet it's not being afforded to people with disabilities. So what does that look like? First, it means that we need to ensure that there's access to reproductive health services and information. Can people with disabilities get to the doctors? Once they're at the doctors, can they get into the building? Once they're in the building, are they able to access adequate care? To give you an example of what this might look like, are they able to get on the exam table? Are they able to be given information on preconception care if they are looking to get pregnant? What are they provided? What type of care are they provided? How are they provided care throughout their entire pregnancy? We also need to make sure that people with disabilities are receiving sexual education. Earlier, Kara mentioned that people with disabilities are often denied sex ed. They don't get it in school. There's this presumption that people with disabilities are not having sex. They are. And so we need to recognize that people with disabilities need to be fully informed so that they can make these decisions for themselves. So making sure that sex ed is available to people with disabilities, and it's available in an accessible manner. So it may need to be available in different formats depending on what type of disability we're talking about. And so just making sure that it's available. And the last thing I will say is parenting supports. So much of the barriers that people with disabilities encounter around parenting is once they've become a parent, and they are discriminated at significant rates. And I know we'll talk about that in a little bit, but making sure that we have a system that really supports people with disabilities if they want to have children, making sure that they have access to supports, whether it's assistance, whether it's adaptive parenting equipment, things like cribs that can be lowered for someone who uses a wheelchair. So just making sure that we have a system in place that really does support people with disabilities if they choose to have children. So we really need to also, I would say, shift our presumptions. There are a lot of presumptions about people with disabilities, as I mentioned, that they don't have sex. There's also a presumption that they shouldn't have children. We saw this during the eugenics movement, and unfortunately, those ideologies still exist today. So really, we need to shift our presumptions, and we need to assume that people with disabilities are capable of raising children. And if they need assistance, we need to provide that assistance. Everyone parents with supports. And so it really does take a village, and that needs to be embraced for people with disabilities.
Thank you for that. And I'll add on a bit that one of the concerns that I have in providing accurate medical information, and then of course support to people with disabilities in living full reproductive sexual lives, including but not limited to parenting, is that in a lot of cases, because we do live in this country where we are failing at providing an adequate social services that people need, a lot of times these gaps are picked up by private, in some cases very conservative religious institutions, which actually control much of the framework supporting people with disabilities in the United States. And when you get the intersection of conservative religion and people living in settings, right, and a presumption that people cannot be sexual or do not have a right to sexuality, that's very concerning and something that I've interfaced with a bit in my own work. So I think that's what you brought up, or you referenced that we're going to talk some more about pregnancy and parenting. So I wanted to move from there to this question. So how have things such as the Americans with Disabilities Act, or the ADA, failed people with disabilities, especially pregnant and parenting people with disabilities? Can you touch on the ways that the foster care system has been used to take agency away from parents with disabilities?
Sure. So the ADA turned 30 in July, July 26th. And so the ADA has existed for 3 decades, and yet the rights of people with disabilities to be parents has continued to be denied again and again. And you talked about, the importance of social services, and I will just say something about that before I continue. And I'm a former social worker, before anyone gets upset. I am a former social worker before I went to law school. But when I hear these conversations about abolishing the police and shifting to social services, I want us to remember that it's social services that is often perpetuating the discrimination against parents with disabilities. So we need to recognize that and deal with that as well. It's often that people with disabilities are inappropriately referred to the Child Protective Services, where they encounter social workers who are not trained to work with people with disabilities, and that's where the problems begin. So when we're really looking at how to restructure our systems, I just want us to recognize that we will also need to deal with those problems. So beginning with pregnancy, people with disabilities just often receive inadequate perinatal care. I mentioned that earlier, but I think it needs to be reinforced. I'll give you a really important example. Throughout pregnancy, it's really important that you get weighed very regularly. And I know that people say, oh, I don't want to know how much you weigh, but that does matter. I know a disabled person who was not weighed her entire pregnancy, and when they went to do her epidural, it didn't work because they didn't know how much to administer to her because they didn't know how much she weighed. So we need to make sure that we're providing adequate perinatal care. That often also results in people with disabilities not being provided adequate lactation assistance if they decide to breastfeed. So making sure that that also is provided in an accessible manner. Also, if people with disabilities want to adopt or become foster parents, they're often discriminated against, and all of this occurs despite the fact that the ADA is 30 and does prohibit all of this discrimination. And then, as I mentioned, people with disabilities are inappropriately referred to the child welfare system, often right after birth. And to give you an example of what this looks like, in Massachusetts, and I feel like I'm picking on that state, but it's where I'm from, in 2015, we had a case that really made national and international news. It involved a young mom. Her name was Sarah Gordon, and she was 19 when she had her baby. And within hours of her giving birth, she had what many new parents have, and that is difficulty with feeding. And when you're not disabled and you have difficulty feeding your newborn, a lactation consultant is called in, or the nurse assists you. But what happened for Sarah Gordon was that the Child Protective Services were called instead. And this led into Sarah Gordon's baby being removed, placed in foster care, where Sarah Gordon was only able to see her daughter once to twice a week, supervised for an hour at a time. This continued for over 2 years, 3 months, and 12 days. Again, 2 years, 3 months, and 12 days, Sarah was removed from her newborn baby. And this was all because she had difficulty in the hospital with a newborn. She was a young mom. She was 19. She had never had a baby before. She also had an intellectual disability, and that was what was used against her. Sarah had a really strong support system, which the hospital and child welfare services knew about. She lived at home with her parents, who were prepared to assist her, and none of that mattered. She faced blatant discrimination. She went through evaluations where the psychologist that evaluated her said that she was fully capable of raising her child with supports, and that didn't matter to the state. She ended up having to get the Department of Justice and the U.S. Department of Health and Human Services involved. And it was only after they investigated this case and issued a letter of findings that said the state of Massachusetts violated the ADA that Sarah finally got her child back. But she missed over 2 years of her child's life. So we need to really understand that many of these problems happen immediately after birth. Sarah's story, unfortunately, is not unique. It happens all the time. People with disabilities lose custody of their children immediately after birth. All of this also occurs despite the ADA, as I said, which violates all of these things. Courts often also misapply the ADA, so we have really bad cases out there where courts have said that this isn't about the parent, it's about the child, and we don't have to comply with the ADA. The child welfare system does not have to comply with the ADA. And I would argue that children's rights and parents' rights are not mutually exclusive. And if you're supporting parents, you're supporting children. So that is entirely wrong. And so we need to make sure that we're fighting for these rights. The child welfare system often doesn't comply with the ADA. I think it's a lot of it, they don't know their legal obligations. My experience with social workers, again, I was a former social worker, social workers aren't trained on how to work with parents with disabilities. They're not provided their own supports. Also, social workers, medical professionals, judges, none of them are immune from their own biases about people with disabilities. So they often will have presumptions that people with disabilities are simply unfit to raise their children because they have a disability. They often also provide really inadequate reunification services. So if you have your child removed from child welfare, you're often given a list of programs or services that you'll need to take in order to maybe get your kid back. And it often involves things like taking a class. Well, these classes are not accessible for people with many disabilities. It's like sending a deaf person to one of these classes and not providing a sign language interpreter, which has happened before, and then faulting them for not actually benefiting from the class. So we need to really make sure that A, people with disabilities don't end up in the child welfare system, and B, if they do, that they end up in a system that really can recognize their strengths and their abilities to raise children. And then we also have to realize what this means for other areas. So one of the big things I want to just point out at the end of before I go to your next question is this also has really adverse outcomes for other areas. So people with disabilities, particularly women with disabilities, have really high rates of intimate partner violence. And at the same respect, we know that disabled women will stay in bad relationships, in abusive relationships, because they fear that if they leave their partner, they will lose the right to their child, particularly if their partner does not have a disability. So this really can have long-term consequences. So we need to really just shift how we think about people with disabilities when it comes to pregnancy and parenting, and really make sure that we're promoting systems that support people with disabilities instead of discriminate against them.
Thank you so much. So much in what you just said is just searing and so upsetting. I do want to underscore, it was very powerful for me to hear you talk about how what's good for parents is also good for children, and this folks shouldn't be pitted against one another within families. A quick bonus follow-on question about this question of parenting and people with disabilities. So we have mentioned Britney Spears a couple of times, and how might a conservatorship impact a person with disabilities and their ability to parent as they see fit?
So that's a really interesting question. And one of the things that happens if you do have a guardian or a conservator, you might not have any say over what happens to your child. And the courts really say, you know, if you don't have legal decision-making power for yourself, you're not going to be able to have legal decision-making power for a child. So having a guardian or a conservator can impact, first, your ability to have a child. We saw, as I mentioned earlier, there was a case in Massachusetts, Mary Moe, where her parents got guardianship so that they could force her to terminate a pregnancy. So guardians have really strong power over people with disabilities. I don't know about Britney Spears' conservatorship and how it affects her as a mother, but this is an issue that can really deeply affect people with disabilities who have guardians or conservators.
Thank you. Okay, one last question from me before we move to questions. So I'm sure folks have questions for Dr. Powell. Please do put them in the question box, and Pamela will get to as many of them as possible at the end. Earlier in your presentation, you discussed the Zika virus times a few years ago. Now we're living in time of global pandemic, and particularly a coronavirus outbreak in the United States that has gone completely unchecked by leaders who have failed to take action. And can you share with us how the ongoing coronavirus outbreak has impacted people with disabilities?
Sure, and I'm really glad that you asked that, and I'm really disappointed that we even have to talk about it. I'm just so frustrated with this whole COVID system or problem and how our leaders are dealing with it, but that's neither here nor there. So I think that we need to recognize that disabled people have been disproportionately affected by COVID-19, particularly people of color with disabilities. We know that people of color in general have been really deeply affected by COVID-19. They've had incredibly high rates of virus, and that is really compounded if you have a disability. There's a number of reasons for that. People with disabilities first have greater exposure. So many of the cases around COVID-19 have occurred in nursing homes, in other congregate or institutional settings, like group homes. And we have to remember that people with disabilities live in these facilities. So they are at greater exposure risk, and we need to work on getting them out. There's no reason people with disabilities are institutionalized. We need to get them into their own homes. So this just reinforces the importance of deinstitutionalization, moving people out of these settings and into their own community-based homes. The other reason, though, that people with disabilities have greater exposure is related to services that they receive in their home. So a lot of people with disabilities, myself included, will have personal care assistants or attendants come in during the day to help us with different activities of daily living. And these people are not being provided appropriate PPE. They're not being provided this. And so people with disabilities are having to really risk their own well-being in order to get out of bed and do things throughout the day. So this is a problem that's really significant. And then we have to remember that a lot of these care providers are people of color, which brings back the issue of really looking at it through an intersectional lens and recognizing who is deeply affected by this virus. People with disabilities often also have greater susceptibility to the virus, and they will experience it in worse ways because of maybe their disability, which may weaken their immune system. So again, this is an issue that's affecting the disability community in major ways. We know that there is a lack of adequate healthcare, even in the best of times, for people with disabilities. This has only been exposed even more during COVID-19. People with disabilities are being denied care. They're being encouraged to sign do not resuscitate orders if they go to the hospital with COVID-19. Also, crisis standards of care is an area where people with disabilities are finding themselves really at risk. So a lot of states have what they call crisis standards of care, and these are protocols that they have developed that say that if there's an emergency and we need to limit resources, this is how we will ration care. And these standards of care often say that people with disabilities will be excluded from life-saving care if we get to a point where we need to ration care. And we're seeing this happen. We saw this happen in other countries, but this is also happening at home. So really, this has been a virus that has really been detrimental to people with disabilities. There's also significant barriers to testing. So many of the testing that is done, you have to drive there, you have to wait in line for hours. If you can't drive, you can't get there. If you're not able to wait in line, you can't get there. So how are we making sure that testing is done in an equitable way? And finally, I think it's really important that we recognize that as we're talking about vaccines that may occur someday, hopefully, that we think about how we're going to distribute these in an equitable way. And we know that people with disabilities and people of color have experienced really significant problems associated with COVID-19. So how do we prioritize them when we're talking about how we're going to distribute vaccines? So again, this is a really big issue that's affecting people with disabilities.
Thank you so much, Dr. Powell. That entire presentation was illuminating, inspiring, infuriating, and gives us a lot of food for thought and tangible action steps to help build a better world together. So I'm just going to briefly wrap this up and toss it over. I've seen lots of good questions coming in, so I'll pass that to Pamela shortly. Please do plug into Reproaction's campaigns. So we run these Act and Learn webinars every month. They're free and they're open to the public. You will never miss an invitation if you sign up for alerts at www.reproaction.org. And please do follow us on social media. We are our Reproaction on Facebook, Twitter, and Instagram. And oh dear, the wrong date is on here, and I apologize for that. Let me get you the right date. If you get on our email list, I promise you'll get the invitation with the right date. But the actual, the topic is correct. We will be doing, actually, no, the topic is not correct either. I apologize, this is an error. So we will be holding our next webinar on Wednesday, October 7th, and our topic will be Beyond Roe. We'll be talking about Roe versus Wade and the need to have a framework that's bigger than expecting the courts to save us, because they were never going to do that. That will be taking place at 3 p.m. Eastern on Wednesday, October 7th. But you will find that so long as you get your invitation. So sign up for alerts at reproaction.org, and I apologize for the error. And with that, I'll pass it to Pamela for Q&A.
Thank you so much, Erin. And we do have a lot of questions. We'll try to get through as many as possible with Dr. Powell. Full disclosure, I am a guardian, legal guardian of my autistic brother. So some of the issues that were being discussed are hard to hear, but very important to hear. And so I'm going to take moderator privilege, if you don't mind. And I just had a question about the role of guardianship and conservatorship because of that incredible responsibility and unchecked power. That what advice do you have for guardians or people who are in a role of conservatorship above just something more than, you know, centering the individual, which is obviously the key. But what advice do you have if people are currently in that role?
So you first said exactly what I was going to say, which is to center the individual. And, you know, you say that's obvious, but unfortunately, a lot of guardians do not recognize that responsibility. So I want to just enforce that it is important to center the actual person and their desires and their wants. I would also say that we need to really reconsider the guardianship system as a whole. I think that we're seeing that many people with disabilities, if they're provided the right supports, can make a lot of decisions for themselves. And so there's a movement in about 18 to 20 states right now where they have developed what they're calling supported decision making. And this is a mechanism that's really an alternative to guardianship. And it really just recognizes that most people, regardless of whether you have a disability or not, need assistance and supports making decisions. So how do we provide these supports so that people with disabilities are capable of making decisions about themselves? Is there you know, appropriate guidance that we can provide so that they can make these decisions? And how do we limit guardianship? So you can have a guardianship and it only can cover one area of your life. So you may need help with finances, but you might not need help with making healthcare decisions, for instance. So how do we really make sure that these guardianships, if they exist, are really limited and not expansive? So we can do that through, again, supported decision making and just making sure that we have very tailored guardianship when they occur. And I recognize that some people will need them, but I think that we have to really change our assumptions and assume that people don't need them unless they do. I think that there is a propensity for just assuming that people with disabilities, particularly intellectual or psychiatric or developmental, need guardians. We're seeing that as people with those disabilities turn 18, we're automatically saying, oh, it's time to get a guardian for this person, instead of saying, oh, do they actually need a guardian? So just changing that conversation. I mean, everyone needs support in making decisions. I often will use the example of I know nothing about cars. So if I'm going to have to make a decision about a car, I'm going to have to go to an expert on cars because I couldn't make a good decision if you paid me. And we all need supports. We all need supports, and we all need expertise when we're making these decisions. Me not knowing about cars doesn't mean I need a guardian. It means that I should get advice. And the last thing I want to say before we move on is there's also this concept of dignity of risk. People with disabilities need to be able to make decisions, even if they're poor decisions. We all, as autonomous individuals, have the right to make good decisions and bad decisions. And if we were going to start limiting who could make bad decisions, most of the United States and the world is going to have guardians, because we're all guilty of making poor decisions. And as long as we understand that we're making poor decisions, we have the right to make those poor decisions.
Hear, hear. Thank you so much for that. And I could not agree more. I think a lot of people and some of our supporters on this call might not be aware of how little the system has changed and how little oversight somebody is legally required to give in order to be able to make all the decisions in somebody, in a disabled person's life. Just mindful of the fact that the paperwork I fill out as a guardian only requires me to visit once or twice a year for an hour or less. So that's thinking about that in our own lives is rather terrifying.
It's shocking. And I will say that a lot of guardians aren't family members. So they're just random, organizations that have hundreds of guardianship cases, and they have no connection to the person.
Just horrible. Thank you so much. So we do have a bunch of questions from our attendees. So the first one is, are there resources you'd recommend specifically around intellectual disabilities and choice, or bodily autonomy in pregnancy options and other reproductive healthcare decisions? Or are there specific organizations you can point to that are leading this work that there seems to be a huge lack of knowledge about this intersection?
Absolutely. So there's a few. So I will first say that the first one I'm going to recommend, I am a part of, so I'm just recognizing that. But the National Research Center for Parents with Disabilities, we have a lot of resources on our website around parenting with disabilities, and we have a lot specifically on intellectual disabilities because that's a population that experiences really significant biases. So their website is centerforparentswithdisabilities.org. So that's a great place to start. I know that the National Council for Independent Living has created really great sex ed videos for people with intellectual disabilities. I would encourage you to look at that. I know that the ARC also has resources around reproductive rights and health for people with intellectual disabilities. I would check those out. And then there's an organization called the Association for Successful Parenting, and they do a lot of work for parents with intellectual disabilities, so they'd be a good organization to also check out. But there is actually a good amount of work out there. It's just not known, which is the problem.
Got it. Thank you so much. The next question centers around what measures are in place to guarantee that somebody is not being coerced into a reproductive health decision or forced into a decision that they don't want to make a medical decision around their reproductive health care. And so what measures are in place at the actual provider or doctor's office from an ethical standpoint or a legal standpoint that might protect disabled people who are seeking care?
So that's a really tricky question. So guardians, if they exist, get to make a lot of these choices. When it comes to sterilization, courts are supposed to have a role in this. So courts have really established different ways to look at sterilization and sometimes abortion for people with disabilities. And a lot of these cases go towards this, what they call the best interest of the person standard. So courts are supposed to decide these things based on what is in the best interest of the person. Unfortunately, we know that best interest of the person actually isn't usually about the person. So if you read these cases, they'll say, we have decided that this woman with an intellectual disability should be sterilized because it's in the best interest of her because it will be a burden on her family. No, that's not about her. It's about her family. Or it's a burden on society, or she'll need too many services. Again, that's not about her best interest. It's the best interest of others. So I think we have to recognize that we're not actually talking about the best interest of the person. We're talking about the best interest of others in so many of these cases. And so I would say that the standards and these procedures that should really protect people are not really first enforced very well. And I think that there's just so much coercion out there. I know people with disabilities who have been really strongly encouraged by providers to A, terminate pregnancies, and B, have hysterectomies if they're women. These were done because the providers had really deeply ingrained presumptions about the person. And as I mentioned at the outset, I've had similar experiences, so I know that these are a problem. And so we don't have great protective measures in place right now.
That's thank you so much for that insight. And it strikes me, just as a follow-up, it strikes me that the lack of protection and measures and what you were saying about the best interest of the individual, it seems like that's an extension of all of the healthcare, the healthcare positioning that we see across the spectrum, because a lot of what you were discussing, I've actually seen even with medication and decisions about medicating symptoms of a disability. That is that in the best interest of the individual, or is that in the best interest of the caregiver or the parent or guardian? Do you think it's an overall positioning and approach, or do you think it is specifically focused or more focused on reproductive health care?
No, I think that the what they call the medical model of disability, so really looking at disability as something that needs to be cured or fixed, instead of looking at it as a social construct, really leads to all of these problems within the healthcare system. Medical providers really first have their own biases, but also are working within a system that is just ableist. And it's really based on this presumption that we need to, quote unquote, fix people with disabilities, not recognizing that they don't need to be fixed. And we have really paternalistic approaches to people with disabilities.
Very true. Very true. Thank you. Next question is one that I think a lot of us have approached over the years, particularly given the fact that many states have had recent legislation proposed that would ban abortion in certain instances. And one of those instances that is often mentioned is in case of intellectual disability, or specifically Down syndrome. So can you talk a bit about the ethics and issues about that converge on that issue? And you spoke when you were doing the Q&A with Aaron about the connection between eugenics and that and ableism. So, when we look at these proposals, in many ways, we think that they've been proposed because they are complex and difficult to navigate, but they also are being proposed because, that they are on the table, right? And they are something that people openly discuss. So I'll stop talking and let you share.
So thank you for asking this. I have very strong feelings about it. So these bans, which are usually Down syndrome bans, where they, these states are purporting to really care about the rights of people with disabilities all of a sudden. And so they say that if there's a diagnosis of a fetus of having Down syndrome, we need to make sure that people are not able to terminate these pregnancies because it would be ableist. That's their perspective. And it's the same people that seem to not care once the actual person is born and is a disabled person. And if they have such an interest in the well-being of people with disabilities, they could stop trying to take away health care from them. So, I think they need to shift their assumption. I think that there's this anti-choice movement that's really trying to pit people with disabilities and the disability rights movement against the reproductive rights movement. And it's really just, trying to expose and hang on to these, as I mentioned, the tensions that exist between the two movements. But people with disabilities, we need to support bodily autonomy. Equity and bodily autonomy at the end of the day are the two main principles of both disability rights and reproductive rights. And as people with disabilities, we need to recognize that. I hate that people feel that they can't pursue a pregnancy if it will end up in having a child with a disability. Mm-hmm. And I think that that's really sad. And at the same respect, I feel that we need to respect people's choice and having that opportunity to choose. And we need to make sure that if they choose to have a child, they are supported. So how can we make it easier for people if they choose to have a child that has a disability? That should be the focus. What can we do? And the other piece is we need to make sure that we're giving actual information. So if we find out that there's a diagnosis, maybe we say, would you like to meet someone with Down syndrome before you make a decision? This is a really difficult decision. What would you like to know? How can we support you so that you can make an informed decision based on all of the information you need?
Thank you for that. And yeah, I'm mindful that when Missouri had a proposal like that, it came down like a week after we were given a letter saying my brother had to quit his job or he was going to lose his Medicaid coverage. So yeah,
right.
A lot of hypocrisy. So we are at time, and we definitely want to respect time. So I would like to thank Kara Mailman on our team for just a wonderful webinar and organizing this and this work. And also Dr. Robyn Powell, thank you so much for your insight and for sharing your wisdom and your knowledge in all of those fantastic resources today. Thank you to our attendees. And as always, thank you to my co-pilot in justice, Erin Matson. I hope everybody has a fantastic rest of your day.